appropriate time. So let's get started. Good morning, folks. My name is Gary Clark, President CEO of Economic Alliance Snohomish County, and I am excited to come to you today with another Coffee Chats with Economic Alliance Snohomish County. So today we are going to dive into a topic that is very clear to everyone, the state of healthcare. And we have some tremendous folks on our panel to engage with today. So we'll go to the next slide or two, and then we'll do our introduction to our panel for everyone. First and foremost, I would like to ask that everyone, please remember to engage with the chat section as we dive in. Please feel free to ask questions, and we may prompt you to engage on some buzzwords and comments as well. Now, without further ado, drum roll, please. Brrr. I have the distinct pleasure of welcoming Dr. Chris Spitters, who is also with Snohomish Health District. Chris, welcome, and thank you for joining us this morning. Additionally, we have Dr. Stephen Campbell with Providence Medical Group. Dr. Campbell, welcome.
Morning.
And we also have Dr. Jay Cook, Chief Medical Officer at Providence Medical Group. Dr. Cook, welcome.
Thank you.
Welcome. And last but not least, at around 9 a.m. today, we will have Dr. David Rushin with Western Washington Medical Group. So gentlemen, thank you so much for joining us this morning. We are going to go ahead and remove the screen, and we're going to probably dive into some panel conversation. We want to make sure that we get everyone a spotlight who is in the panel group. You can see my scary face first, and then we'll dive in with everyone else. Folks, this is an amazing opportunity for us to engage on healthcare, but first things first, we want to know who are the gentlemen that we see in front of us. And so I'm going to start off with Dr. Cook, and then we'll go to Dr. Campbell, and then finish with Dr. Spitters with just a brief intro on your career, and then tell us how the last few years have been for you career-wise. So Dr. Cook, take it away.
All right. Well, first, thanks very much for having me today. I really appreciate the opportunity to talk to this group. My name is Jay Cook. I'm the Chief Medical Officer here at the hospital, Providence Everett. I am a native Texan. I grew up in a small town in Texas, went to medical school at the University of Texas, then came out west to do my surgical training. I'm a vascular surgeon by training and came to Everett, Washington to practice. At the time in 1991, there was both Everett General Hospital and Providence Hospital in 1991. They merged, as some of you may remember, and a few years later. I spent about 25 years as a practicing surgeon here. A number of years ago, I had the opportunity to go back to school and get a business degree, and then assume this role of Chief Medical Officer about 5 years ago. As you might imagine, the last few years have been quite challenging, and you all know we had the first reported patient with COVID-19 in the United States who presented to one of the Providence Medical Group clinics and then was admitted to Providence Hospital a day or two afterwards. That has really changed everything. We'll get into some more details, I'm sure, during the conversation here, but I think that all medical professionals will tell you more or less the same thing, that there have been more changes and unanticipated events and reactions to events than we could have ever imagined a couple of years ago.
Thank you, Dr. Cook. We'll just move it along to to our next panelist.
Hey, good morning, and thanks, Gary. Appreciate the invitation. Good morning, everyone. I'm Steve Campbell. I'm the Chief Medical Officer for Providence Medical Group. Jay is on the hospital side. I'm on the medical group side. I've been in my role for just about 3 years. I'm a family physician by background with 20 years of practice experience, most of it with the Mayo Clinic in southern Minnesota. I've been back in the West Coast. I say back because I'm originally from Western Canada. I've been back on the West Coast for almost 6 years. First 2 of those was actually with Everett Clinic. I spent a year down in Southern California. And then, like I said, I've been here for just about 3 years now. Providence Medical Group is exclusively within Snohomish County. We have about 280 physicians and advanced practice clinicians in our medical group. So happy to be here.
Thank you, Dr. Campbell. And Dr. Spitters.
Well, thank you, Gary, for inviting us, and good morning, everyone. So I'm Chris Spitters. I'm the health officer for the Snohomish Health District. So that's basically, I function as the chief medical officer for the health district's limited clinical operations and overall efforts in the community. And then I'm the legal entity for enforcement of public health laws, rules, ordinances, and such. I was trained in preventive medicine and public health, and came to Snohomish County in 1994, and have been connected with the health district in one way or another ever since that time, except for a brief stretch of about a year. Most of that time, I've worked as a tuberculosis physician, taking care of patients here in Snohomish County, in King County, and in other counties around the state. And then, my COVID personal story is that I was, juggling all those jobs and filling in for the vacancy that existed at that time with the health district here. And then when COVID hit, just got fully pulled into that, and had to drop all my other work, and, was fortunate to become the health officer, but also, set in the past 20 years of work on other things. So, and it's really been 95% of my time for 2 years now. And so we're an agency that's usually runs about 120 staff or so. And right now we're at about 200 due to the additional staffing pulled on for the COVID response. So, this is a healthcare discussion, and I just wanted to add that, these 2 gentlemen and Dr. Russian, who will be joining us, first have been fantastic partners of the health district. And while we have overlapping interests, they're where the rubber meets the road with healthcare. It's the individual who's the first subject of concern, and then of course they are interested in the community. Whereas our primary focus is on the community, and we get involved with individuals only when doing so is in the interest of a community-wide interest. So we have very limited healthcare clinical services, really limited to those situations where it has an impact not only for the individual, but for the person down the street. And that's one key distinction about our overlapping roles. But I couldn't be working with a better group of healthcare partners than we've been through in this pandemic. And I'm really grateful to both you, Steve and Jay, for that. So back to you, Gary.
All right. Thank you so much, Dr. Spitters. I appreciate the work each of you do in our community and beyond. And really, as you can see in the chat, folks are very thankful for our healthcare professionals across the board, and the efforts and risk that you all have taken to make sure that everyone can get back to their families in some way, shape, or form. I want to ask a question and jump to Dr. Cook with this, and then we can just go around the room. Dr. Cook, I'd love to ask you about the misconception in the community, if you think there is one, due to the current effects of the variant. Do you feel that there is a misconception from the community about the current impacts of the new variant?
Yeah, thanks for that question, Gary. That's a really important question. You know, from the very beginning, we heard that Omicron was less severe. And I think, you know, while in an individual case that there may be some truth to that, on a population perspective, that's completely wrong. And I'll try to explain why. It's like a lot of things. I think communication of the details of this they're very challenging, even for those of us in the business. And it's even harder to convey a lot of the technical knowledge in a way that people who don't understand the technical knowledge can get. But I think simply put, you know, an individual, you know, case of Omicron compared to Delta or some other strains may not seem to be as severe in terms of risking hospitalization or severe disease or death. But because the Omicron variant was so much more contagious, so much more transmissible, so many more people got infected with Omicron that even though each individual had a less risk of hospitalization, when you increase the population who are at risk, the number of people getting really sick and going in the hospital and dying really went up. And so in that sense, Omicron to the population was not severe at all. And in fact, we saw record high hospitalizations both here in Everett and across the United States, record high deaths, record high, well, I may not be right about deaths, but I know record high hospitalizations everywhere. And so I think that, again, it's challenging when things can't get simplified to a soundbite. So I think that was a bit of a disservice, you know, and a misunderstanding, misconception from the beginning. And I'd love to hear Chris knows much more about this than I do.
Well, I don't know about that, Jay. I think you've been right there at ground zero with the hospital there, but certainly Jay really hit the high point there that yes, on an individual level, less likely to result in severe disease. On a societal level, much greater disturbance of access to acute care than ever before in the pandemic. Furthermore, more children hospitalized than ever before in the pandemic. And, you know, and all of this occurring 2 years into an ordeal where the communities kind of collectively got some fatigue in dealing with this. And the healthcare system that is responding to the need is facing staffing shortages, fatigue, burnout that wasn't there as much earlier on. So it's this, you know, Omicron thus far has been the, you know, the mother of all waves. We certainly hope it's the last, or at least the most severe. I think it's unlikely that it's the last wave. We don't really know what the future holds, but certainly hoping for things to kind of settle down over time. But yeah, it's been a real challenge between the extent of the impact on society and our collective fatigue and you know, staffing shortages in healthcare, public health. You're seeing it in schools. Probably many of you on the screen are having staffing shortages as well.
Thank you, Dr. Spitters. Dr. Campbell, any thoughts?
Yeah, I can just add just a little bit. And I think Dr. Spitters used the key word, and that is fatigue. You know, everybody's tired. We've been at this for 2 years. The healthcare system is tired. We as just a general population are tired. And you throw into that, you know, I think for the most part, we all know there's exceptions. We've done a pretty good job of getting many vaccinated. And so there's a lot of trust in the vaccine. Unfortunately, you know, the vaccine's not 100%. It's better than no vaccine. And what we saw, you know, speaking on the ambulatory side, with respect to Omicron, and Jay's point about just a higher population with it, is it really overran our urgent care clinics. To the point where we actually had to stop registration sometimes two times a day, as we were literally having, just in terms of hours, dozens of people wanting to be assessed for either just a test or for symptoms. And what that does, not unlike bottling up the emergency department, is it really impacts access to care for people who have non-Omicron stuff. Whether it's an injury, whether it's some other medical crisis that isn't, Omicron related, we're really challenged to respond to those people. And again, all in the context of we too, on the ambulatory side, just as kind of exhausted and tired of this as everyone else.
Okay, well, I appreciate these comments, gents. I'd like to ask about social media now. And before I do that, I want to ask our audience and our businesses and partners and nonprofit leaders who are on this call to maybe put in the chat what comes to mind for you right now. Is it fatigue? What are you feeling? Kind of a word association. If you can just mention by one word how you feel right now during this time, we'd love for you to put that in the chat right now. But Dr. Campbell, if you could start off, and then we'll go to Dr. Spitters and then finish up with Dr. Cook. Social media, impact of the overall perception of the pandemic. Do you think social media has had a major impact on the perception? Dr. Campbell, can you start?
Well, I think we will all come at this question with a bias. And I think back to when the polio vaccine was developed. And essentially we've eradicated polio for the most part. And if we had social media back then, would that still be the case? The thing about social media is you can choose what you want to look at. So if I'm super skeptical of vaccines, for instance, I'm going to follow more, whether it's Twitter, whether it's Facebook, I'm going to follow more things that align with my questions and beliefs that may actually help with my narrative. And the other side too. I mean, I followed a couple of high profile national scientists, Dr. Bob Wachter, Dr. Can't remember his name right now, out of San Diego, who really were, almost posting things daily on what was going on in the world. So, not that long ago, it was, hey, here's what's happening in South Africa, and then on to the UK. So there's positive and negatives when it comes to disseminating information, some of it accurate, some of it, of course, questionable.
Dr. Spitters?
Well, certainly, and certainly it's had an impact. And like most things, it's neither all bad nor all good. Our communication staff, though, does have to spend a lot of time just watching social media to try to, it's a universe of thoughts out there, and we try to keep up with it and respond to misinformation, disinformation. From a broader perspective, my thinking is that, historically accessing people through traditional print and broadcast media requires vetting because there's a limited space. And so fringe ideas at any extreme tend to be filtered out. And, there's a little bit more fact testing and accountability. But now, everybody has a microphone and there's no vetting and very little accountability. And so on the one hand, we're able to broadcast information that's helpful to a wider audience and attract people or get messages to people who wouldn't otherwise be watching traditional media. So that's the good news. But the bad news is that it either mistaken, misinformation or deliberate disinformation is much more common. And as Steve was saying, you can get in your echo chamber, and then that's exacerbated by the way search engines work, which is, they based your results on your past, what you've looked at in the past. So overall, I don't think it's a tie. I think it's been less than helpful, I'd have to say. I think as a society, we face a big challenge going forward on how to mitigate the negative impacts of social media while reaping the benefits of its positive aspects for this and for all kinds of things.
And I don't have much more to add. I mean, I'll echo the fact that it does seem to make us more polarized, since we are all tend to follow and read what we already believe, and it's easy to do that on social media. The other thing I'll go back to, I think I mentioned in my first set of comments, an evolving virus like the COVID virus, we're learning about this all the time. And so social media, it can be a vehicle to, disseminate information quickly and widely. And that's been good. I mean, there are chats with intensive care unit doctors, with ED doctors, and really information has been spread informally, but quite effectively, very quickly around the world, really, about a lot of this. And at the same time, as others have mentioned, there's information that is, I think, sometimes purposefully misleading, and a lot of the science is confusing. A lot of the science can be seemingly contradictory. It doesn't lend itself to sound bites, and it evolves. It's, what seems true today may not prove to be true in the future, and that's just the way science works. I mean, and I think that we've seen, the public has been able to see what those of us in the business have known all along, that it's sometimes messy, it's sometimes controversial, there are disagreements, but I think what separates the science is that the real scientists are really going after what the truth is. And I don't know that everyone who is on social media has that same goal. I'll leave it there.
Okay, we did have a question in the chat about Omicron and kind of asking whether or not you believe that there is any truth to the fact that it seems as though this variant has impacted children more. Is that true? And I'll jump to Dr. Campbell first, and then Dr. Spitters, and back to Dr. Cook.
Well, I'd have to lean really on what I've seen in the in the lay press for the most part. I can tell you, I have a fairly large pediatrics department here, and they have not been raising their hands saying they're overwhelmed. But nationally, there seems to be more kids being hospitalized with Omicron. What I don't know, and maybe Dr. Spitters might, is that percentage actually any different than other variants?
Well, I think you nailed it, Steve. It's really the number of infections in kids and in all age groups, except, the older adults have done a good job between vaccination and I think social distancing, relatively less affected by this Omicron wave. But, middle age, younger adults and children, just many more cases. And so what's really driven the visibility of kids seemingly more affected and more hospitalizations is just Omicron's ability to infect everyone and its ability to at least partially evade immunity acquired from a vaccination or prior infection. Still, even with that, still great protection from vaccination against severe disease. But because younger kids aren't as vaccinated as well, not as much coverage, And they're also back in school much more than before, so mixing around. So there's nothing really biological about this, like that the strain has some leverage over children that it doesn't over older age groups, or that previous strains didn't have over kids. I really think it's just exposure, acquisition, infection, those numbers getting so high that it becomes more visible.
Yeah, and I really don't have much to add from what Dr. Campbell and Spitters have said. We've seen only a handful of kids with COVID that are sick enough to be hospitalized, and we tend to transfer all of those to Seattle Children's, and even there, they have not been overwhelmed with COVID, even though they receive referrals from across the state. But it does, that's just the people who are sick enough to be hospitalized. And I think that there are, a lot of cases in the community as Dr. Campbell and Spitters have indicated, and it is sort of a reservoir for transmission, through the schools and after school activities and into their parents and, throughout society.
Well, I'll tell you all a little TMI from my end. I am at home currently because my son, who got his shot on Saturday, is having a little bit of complications, headache and slight fever and whatnot. So if you hear barking or yelling, it's my 7-year-old trying to maintain silence for me. But there's an additional question in the chat from Whitney, who asks, has the pediatric population being hospitalized shifted downward by age, with the under 5 still unable to be vaccinated? So Dr. Cook, I'm gonna throw it to you to start it there.
Yeah, I don't have an answer to that, to be honest with you. Is again, we see very few kids sick enough to be hospitalized. Our colleagues at Seattle Children's, who I have not had an opportunity to touch base with over the past few weeks, have told me in the past that it's sort of a range of cases. There are definitely newborns that are infected with COVID, and there are teenagers who are infected with COVID, and I'm not aware that any particular age is more susceptible to severe disease, but I'm really not certain about that.
Yeah, the rates, if you look at the numbers of hospitalizations or the rates, so that would be the number of hospitalizations per population in a particular age group, are still, highest in older adults and middle-aged adults. And as age comes down, so does the risk of hospitalization. It's just that so kids have had, more hospitalizations than ever before in the pandemic, but it's still far lower than what we see in adults and our elderly community members. So there you have it.
Dr. Campbell, you want to add anything? Or?
I don't think I have anything more to add.
Okay.
My two colleagues said.
Well, let's shift gears here and let's just talk about the pandemic overall, and ask a question. Dr. Campbell, we'll start with you. What do you think trends are showing us about the pandemic now that you're seeing in general? Can you speak to that? Just overall trends that you're feeling?
Well, specific to what's happening right now, we are seeing, a significant drop in cases. I can tell you our urgent care clinics are almost back to normal in terms of their volumes. Dr. Cook can certainly speak to the number of patients that are in the hospital with COVID. And maybe it's when I don't know the timeline. We see other states, California, New York City, starting to lessen some of their mandates, mask mandates in particular. Not sure if there's been discussion yet of timing in Snohomish County or within the state. And today's what, the 15th. So in 2 days, elective surgeries will resume, which were essentially halted under the governor's mandate. So our task in healthcare is to really get back to business of delivering the care that people need and deserve, that is separate from COVID and that has essentially been choked off by the overwhelming numbers of COVID infections.
All right, Dr. Cook, you want to jump in there?
Yeah, sure. So, from a hospital perspective, we here at Prov Everett, we have roughly 600 licensed beds. And at the peak of our surge a few weeks ago, we had over 200 COVID positive patients. So about a third of the patients in the hospital were COVID positive. And, that's one thing. And as Dr. Campbell has mentioned, the other piece to the challenge has been the number of our staff who have, because of the transmissibility, even those who were vaccinated, a significant number did contract COVID from contacts and family, what have you. None of them that were vaccinated got really sick, but they did have to quarantine for, sometimes 2 weeks. And that had a big impact on our staffing, which coincided, unfortunately, with this big surge of patients to create a very, very, very challenging situation. And I know we're not the only ones. There are twice weekly phone calls with other hospitals in the Puget Sound region from King County and Pierce County, Thurston County, up and down the I-5 corridor. And everybody has a variation on the same theme. Too many patients, not enough staff. And the other component of the healthcare system that's been hit really hard is the post-acute care piece, the nursing homes, the adult family homes, long-term care facilities. We have over 100 patients at our hospital now who do not have a continued need for inpatient care, but we cannot find a safe or suitable place for them to go after discharge from the hospital. And those are resources that we really need desperately for people who have acute illness. That is what we do, and we feel very confident in our ability to care for those folks. But it's very challenging when resources are needed to care for those who really would be better served in another place. So all of these factors have converged in a very challenging way. And I'll say that, I think our healthcare system, when from the outside, we're doing okay. The numbers are coming down, and I can't deny any of that. But the fact is, we as a system, as a healthcare system, and I'll speak for the Puget Sound region, are precarious, and more so now than we've been at any point during the pandemic or in my career.
If I could just add to that, Jay, it speaks to really the economics of healthcare right now. For healthcare to succeed economically, you have to be functioning at capacity. So the ability to take a big hit like COVID has been extremely challenging. No fault of anyone's. It's the nature of how our healthcare system is.
Yeah.
That's right, Steve. And because of that and our reliance upon that system, when there is a shock like COVID, you need the ability to expand capacity beyond. I know you know this, but for the participants here, we need to be able to expand capacity beyond normal to deal with that shock. And I think that's probably been one of the weaker aspects of our response, and hopefully is part of the post emergency response review about how would we handle this, either with a future wave or with another shock to the system down the road. And you know, Providence and outpatient healthcare providers have done a lot to try to adjust to the situation and maintain or expand capacity. So that's been a valiant effort, but I think that sort of a external addition of capacity to deal with people who are, I think roughly, I don't want to, you know, take your words, Jay, but or take your words away from you, but there's about I think roughly 100 people at a time at Providence Hospital who are there, but don't really need hospital care. They're just having placement problems. They don't have the right place to go to. Dealing with that, taking some heat off the system so that, you know, when we get these waves or other types of shocks, that the healthcare system's not thrown into even a more precarious state.
With that in mind, then there seems to be a need for systems to improve. It sounds like talent, workforce, and capacity levels are being explored to make sure that there is enough bandwidth, so to speak. Do you all feel as though you've reached that level of engagement in your different respective places? And anyone can dive in on this if you'd like.
You know, if there's a silver lining that has come from this pandemic, and, you know, I speak from an ambulatory perspective, you know, 2 years ago, for instance, we would have never thought of having a doctor's appointment over a Zoom call. And now it's becoming very commonplace for many. And I mean, why is that succeeding? Well, to be honest, because the payers will pay the same for that visit as a face-to-face visit. So economically, it makes sense. The other is, you know, we're just seeing an explosion of startup companies, you know, wanting a piece of the $4 trillion healthcare budget. I wouldn't call it a budget, the $4 trillion market. And so I think more of us are going to really get further deeper into using technology in healthcare, you know, analogous to, you know, the banking industry, the airline industry, and really bring healthcare into the 21st century. I don't know what it looks like, but I think we're going to see some great things over the next few years here as we bring more tech into healthcare.
Well, thank you, Dr. Campbell. I see we have our other panelists on, Dr. David Russian, who is actually with the Western Washington Medical Group. He was out probably helping save someone's life, so we appreciate you joining us.
Actually, I was at our finance committee because no money, no mission, but that's not an optional thing for me. So I feel like the special extra guest. So thank you for having me.
Thank you very much. I want to do you the honor of allowing you to give us a little bit of a synopsis on who you are and a little bit of your background. And then what I asked the other panelists and doctors to share was how it's been for them in the last couple of years. So putting you on the spot, but
Sure. So I'm a pulmonary critical care doc by training, and I go way back into the 1990s with Jay and Chris, and actually go back a fair ways with Steve as well. And now I'm the CEO of my group, and our flavor, a little bit different than some of the other folks on this call, is that we are an independent, you know, for-profit group in the county. Independent, different than, for example, our colleagues at the Everett Clinic, which is a for-profit employed group. So we're all different, and I actually think that's one of the strengths of our county, that if someone didn't already talk about it, the level of communication and cooperation among everyone in our county is not typical across the country, and I think that's served us quite well during the pandemic. And shout out to Jay and Chris for running a weekly call. If they didn't talk about it, that we all get together and talk and try to solve problems as a community. And it actually is special. I have a lot of friends in New York where I did some training, and it ain't that way in New York City for sure. So that's super cool. Our challenges has been, this has been as Jay just said, it's been a huge stress on everyone that's involved in healthcare. I don't know if folks have talked yet about burnout, but have a huge amount of burnout, both of providers and staff. And so there was a question here about social media, and social media has not helped in any way, shape, or form. This has created, huge controversies that have helped us, from moving the ball forward. That said, the CARES funds help Western Washington Medical Group survive, and I think we're in a better spot. And I couldn't second. I would like to really second what Steve just said about having this be a jump starter, a catalyst for some technological innovations. I think will serve us well going forward. And I also believe that this is a little bit about trial by fire, for some of our providers and staff that, having been through this, I think we'll have a shared experience, as tough as it was, that will make us stronger.
All right, well, thank you, and thank you for joining us. I want to ask a quick follow-up question for all of you, and we'll just say dive in if you feel like answering, but does the use of the word endemic suggest that the next variant will be routine, like the annual flu?
Well, maybe I'll take, as a public
Yeah,
health
Chris,
guy,
you're
Chris is the guy.
I'll take a shot at it. But first, I think it's a unfortunate use of the term. It implies some stepwise exit from a bad situation to a good situation. The actual definition of endemic is that stable, steady state rate of a condition or an infection in a community or population over time. It doesn't get worse, it doesn't go away. That could be at a very high and troubling level, or at a very low level. And it's not something when you're having a pandemic with new exposure to a communicable disease that ebbs and flows. It's not like a light switch. It's not like there's going to be a day where we go from having a bad time to it just being a small problem. Certainly our hope is that and our long-term vision is that, a low level of ongoing coronavirus transmission will exist like it does for other human coronaviruses that in the unrecorded past also probably jumped from animals to humans, and then after wreaking havoc for years or decades, did move into that lower consistent rate that's kind of driven by seasonality. Most of the other coronavirus infections, that they cause about 15 to 20% of colds in the wintertime. It's usually a winter thing. And most experts think that as this rolls along, at some point, 2, 3, 5 years down the line, this will be mostly a winter-driven respiratory virus, much like influenza, hopefully with lower severity and less widespread transmission than currently, as we mount more population immunity. So that is likely the direction we're heading, but the speed and trajectory remains to be determined.
All right, well, thank you very much for tackling that. Did anyone else want to take an additional stab at that? Looks like I'm getting a lot of head shakes of no. Well, let's ask another direct question for our audience here. And I think one of those questions that we have is, how can we as a community do our part now where we stand during the pandemic? What are your thoughts on what the community can do to better move us in the right direction? And so let's dive in with Dr. Cook, and then after that, anyone who would like to jump in after that, I think that would be great.
Yeah, well, thanks for that difficult question. I think that there are a few things, and let me preface by saying, it's been a long 2 years, completely understandable, and I personally agree with kind of trying to figure out ways that we can not be locked down and do so safely and not put those who are super vulnerable at risk of hospitalization and death. We've had far too many deaths. We've had far too many hospitalizations. We've had far too many people who don't have COVID, but have had problems accessing care because things are jammed up, as we've mentioned before. I think the first thing to do is for leaders to really keep harping on is vaccination. I mean, that's the single best thing we have. I mean, it kind of from a doctor standpoint, if you can prevent something, that's what you should be doing. The hundreds of millions, probably into the billion, I'm sure into the billions now of doses have shown that these are safe and they're effective. They're not perfect, but they're effective, and they're effective at keeping people out of the hospital. And they're effective against having too many people die. And so first and foremost, that's the thing. The second thing is I think particularly in the winter months and particularly when we're having still high levels of transmission in the community, I think it's important to mask and distance. Does that mean you can't go to a restaurant? No. Does that mean you can't, do other things? I don't think that means that at all. I think it means that when you're in places like that, that you're careful, that, when you have a chance, you mask. When you're eating, you're not going to wear a mask, and you want the tables to be separated a little bit. But, I think there's some common sense things that we can do. Avoid really crowded indoor spaces when there are, when there's a high incidence in the community. There are countries around the world that have done a better job at controlling hospitalizations and deaths than we have. And I think those are the things that they do for the most part, to be successful. I'll stop there and have others chime in.
I would point out another part of it that, based on some of the questions that are coming through, there's controversy here about the way we've handled it, and as Jay pointed out, we perhaps didn't succeed the way everyone on this call would like us to. But I personally think that the advice and guidance we're getting from Governor Inslee and from our public health officials, Chris and others, is pretty good. Is it perfect? No, and it's changing because we're learning, and as the pandemic changes, it's changing. And I disagree with some of it personally, but I do think it's important for leaders in the community to support those efforts, because if we're all rowing in the same direction, we're gonna do better. And again, and I may disagree with certain things, but that's not the messaging I give to my group, because nothing's perfect, and what is it? The perfect is the enemy of the good. And I think we need to frankly come together more as a community. And I think the question about what you all can do would be to support our public health officials who are trying to get us through this in the best way possible.
Dr.
Okay.
Ruffin said exactly what I was going to say too, is I think we just need to trust our public health officials. I don't think we'll argue with that.
Yeah, well, thank you for that. Yeah, that's welcome. And our healthcare community has been overwhelmingly supported, even when it's been difficult or there have been disagreements. And so I think that's kind of the in terms of discourse and accommodation and compromise, which I think is the one of the key ingredients to the success of our society, is the ability of us to all kind of try to meet at the 50-yard line and work out what seems to be best. And in that context, I think, going ahead, the regime, if you will, that we've had for the past 2 years is not sustainable in terms of government, running around telling everybody what to do all the time. But on the other hand, it's also not sustainable to have the hospitals and outpatient and other aspects of society being overwhelmed by the virus. And so, in the long run, I think we're really going to need people to personally adopt common sense, as Jay was saying, around things like masking and distancing and avoiding crowds and, getting vaccinated, all that kind of stuff, and view it as not in the way I see the forthcoming likely downgrading of mask requirements, being such a big deal. And like, when's it going to be? And what are the metrics? And what's the date? They're going to come off at some point in the near future. And then likely at some point in the medium to long-term future, more likely more than once, they're going to have to go back on. And from my perspective as a public health official, I'd love to just make that recommendation and have most people follow it, rather than it being like a battle of wits over the science and the non-science aspects of it. And so I think that's the key thing, is for us all as individuals and organizations to kind of own that this is happening. It's not going away soon. Maybe the worst is past, hopefully, probably, but we're not done with it yet. And along with influenza, which every year puts the healthcare, most years, also into a periodic crisis with demand for services. Now we're going to have 2 seasonal viruses doing this. And so I think our ability to get through as organizations, businesses, schools, really requires that we take ownership over it and exercise common sense voluntarily out of self-preservation and the common good. And I think if we can do that without having to extract and require it and argue about it, it's going to go a lot better for all of us going forward.
Well, gentlemen, I want to make sure that we all get a chance to have some closing remarks here as time winds down. We have a few more minutes left. There were some questions about the Super Bowl and what your thoughts were on seeing that huge event take place. Also, there were some questions that we did not get to, which was tied to the impact in your specific industry. And I think we did touch on a few comments. Dr. Campbell touched on a few comments earlier. I'd like to wrap this all up into an opportunity for you to speak in your closing remarks on some of this, one being the Great Resignation as well, realizing that it's impacted not only the business community, but we also realize that the healthcare community is a business community participant as well. So we'd love to hear your thoughts on that. But then last but not least, each of you take a few minutes to give your closing remarks. And that means that you have the freedom to flow whichever direction you'd like in these closing remarks. We'll start with Dr. David Rushton first. We'll go to Dr. Campbell after that. And then we'll go to Dr. Cook. And then last but not least, Dr. Spitters, if he's okay with that. So Dr. Rushton, you have the floor.
Okay, so regarding the Great Resignation, in our group, that's a bicameral event, meaning we've actually not had trouble recruiting providers. We're in an area with a huge amount of innovation, and a lot of folks want to be here. So recruiting doctors has actually not been an issue. It's been easier than expected, and I don't think the pandemic has hurt that, because people still want to get jobs when they graduate from medical school. But perhaps more importantly for the community is our support staff, medical assistants, nurses. They're in an environment where wage inflation is huge, and that's a direct expense for us that's increased our costs. And I think it's been an even bigger cost for the hospital with the traveling nurse kind of disaster. And what we're doing to help with that is we're trying to set up internal training programs for medical assistants, for example, so we can train our own and grow our own and hopefully provide jobs at a fair wage that will help the community. As far as true closing comments, I'm very proud of how our community has handled a very stressful thing. I mean, Snohomish County is we've got two sides of the equation here, and that's just what we're like as as a people in our country right now, and we're doing okay overall. I mean, we could do better for sure, but I think we do come together in ways that make us reasonably effective. And I'm definitely a glass half full guy. I think we're going to be better going forward. I hope some of the political waters and the social messaging things calm down. I do believe that will happen, and that we'll be, in a better spot going forward. I do think the masks will ultimately come off, and we'll be able to see each other and be okay for it. Also want to point out the Super Bowl was outside. They probably should have been wearing masks, but I think the comparison between sitting in the upper deck and being in a kindergarten classroom is not a good comparison. But I wanted Cincinnati to win anyway. So.
Thank you very much. And I need to make a shift here because Dr. Spitters does have to take off. So we'll let you jump in, Dr. Spitters. And I mean, we're in a pandemic. I should have realized that. Go ahead.
Oh, no, thank you, Gary. And yeah, I'm sorry, folks. We have a weekly press briefing that I've got to run off to momentarily. I think my last set of comments really were my, key bottom line is looking forward. How do we operate and accommodate collectively and cooperatively as a society for our own good and that of those around us. And I think just, being willing and able to compromise and also, kind of do things voluntarily and sort of in the spirit, we don't always agree. We can't please everyone all the time. But like David was saying, once we've got a play call, let's run the play. And even if that's maybe not the play we would have called. I think we've got a great history of doing that. I've been tremendously grateful, as I said earlier, for the collaboration, support, efforts of the healthcare system. And I don't think there's a luckier health officer in the state of Washington. So I wouldn't have wanted to do this anywhere else. So thank you all. And I've got to run. I look forward to the next opportunity. Take care.
Thank you very much. All right, we can go with Dr. Campbell.
Sure, and I'll be brief to be sensitive to people's time. The expression "don't let a good crisis go to waste," and we've certainly all been in crisis mode for the last 2 years. But the lessons learned. In our lifetimes, we may not encounter a pandemic like this again, but we're certainly learning from it. But to springboard on my earlier comments, that moving medicine, the world of medicine, further into the technological world, and how tech can really help complement medical care. I think that's. I'm going to steal David's comment. I'm a glasses half full guy too, and I think that's just going to be a huge positive that comes out of this. And so therefore, I don't think this crisis will go to waste, locally or nationally.
Thank you very much, Dr. Cook.
Yeah, well, thanks everybody for joining in today. I think what I'm going to say applies to healthcare, but applies to things in general. I mean, my thoughts are that as a society, we need to come to some agreement on, how much we value the common good and personal freedoms. And I'll put freedoms in quotes because, what are freedoms in the United States, are just lifestyle choices in other parts of the world. And so, that's an area that people disagree, and we've got a huge diverse country, and there's going to be some disagreement, and that is part of the fabric of society. But I think that COVID is really, and the longer it goes on, the more the divide kind of separates us here. The caring for the common good in terms of those who are vulnerable to disease, in terms of those who are older, in terms of those who don't have access to health care, is really laid bare the inequities. And again, that's healthcare is just one piece of all this in our society. So, I think that it's just an open conversation that as a society we need to keep having about how much we are willing to have our ability to do whatever we want versus the impact that has on others in our society is a conversation we're just going to need to keep having.
Well, this has been a tremendous conversation. I really appreciate each of you joining us. Dr. Campbell, Dr. Russian, Dr. Cook. We really, really appreciate the work and efforts of the healthcare community in the last couple of years. And I know there will be more work to be done, but I feel like there is some energy moving in the right direction, and we'll continue to tout the efforts to make sure that everyone's safe and doing the right things as best we can. With that in mind, each of you get to be a part of something that we do every week. And that is the opening up of the full screen so you can see everyone. And I'm actually going to highlight the fact that on February 22nd, Coffee Chats will have the State of Utility led by Snohomish County PUD CEO, General Manager John Harlow. And then save the date, March 31st, folks. That is an in-person event, and it's at the Edward D. Hanson Conference Center, and this is going to be the State of Everett. So please mark your calendars. And Annette, if we can shift to the full screen for everyone to see each other, to gallery view. Folks, what we do here, let's show our doctors what we do here. If you have your coffee cups up, please show them in solidarity. And I actually have a Bywater, so. Okay, folks, please be safe. Pay attention to the information that comes out from our healthcare professionals, and have an amazing Tuesday. Thank you all for joining us today.
Thanks, everybody.
Thank you, guys.
Thank you.